Um, so this is the I have taken it from the AVRI neonatology. This is the showing the tidal volume, functional residual capacity, compliance and resistance of the normal infant, well preterm baby in RDS and in BPD cases.
Good. So except the workup breathing, everything else would be seen on the ventilator as well. And some ventilators may give you the workup breathing as well. So just familiarize yourself with the range for this. So when you're looking at the ventilator screen, Dr. Akansha already mentioned about the range for complaints. I mean, so obviously in diseases which have a low complaints and so good presentation overall. You can close the slides. I mean, stop sharing now. Thank you, Dr. Avneet. And I think both presentations were very helpful and useful. I'm sure the colleagues would agree that they reinforced what they learned from Dr. Abdul Razak's presentation as well. This is a complicated subject. Pulmonary mechanics is not an easy subject, but it forms the crux of most of what you will learn after this. So it's an important topic to understand the basics, and I would encourage all of you to just to revise it again. The issues like the laws that he discusses, Dr. Abdul Razak has discussed very well. Laws related to pulmonary mechanics. I mean, there are only 3 laws that he has discussed, and they're all important. Try to go back and teach. I mean, when you relearn it and go back and teach, and then when you're teaching, you'd understand that you have some gaps. Then you can go back and discuss it again. So we will take a couple of questions each from Dr. Akansha and Dr. Avneet. Anyone wants to ask them, please raise your hand on the Zoom, and then we will unmute and speak. Maybe we'll start with Dr. Avneet commenting on Dr. Akansha's presentation and vice versa.
Sir, Dr. Kanksha's presentation was good. It was, in fact, excellent. It has explained, it has made my presentation also easy with all the that compliance and FRC and compliance are interrelated only. It was a good presentation covering each and every aspect.
Okay, Dr. Akansha.
Thank you so much. So yeah, the presentation was very nice. I learned something new from FRC presentation, like the extubation part and the tape removal part. And also I learned the FRC, how FRC affects what are the various implications like in apnea. I had no idea about that extubation part as well as apnea. So I learned something new. Thank you so much.
Both of you were very fluent and you put in a lot of effort to prepare your slides. I hope you're okay for Jyoti to share the presentations in the group.
Yes.
Yes, sir. Thank you, sir.
Now, please open your videos. I would request everyone to open your videos as well. Dr. Lethil, do you want to comment or ask any question? Can you hear Dr. Lethil? Dr. Kamaldeep?
Hello.
Yes, Dr. Lethil, can you? Yeah.
Hello. Sorry. Yes.
How are you? How is the
I was
weather in Zimbabwe now?
Yes.
How is the weather in Zimbabwe? Is it cold or it's okay?
It's very hot in Zimbabwe.
Hot.
Yes. Okay. Thank you very much. I think both presentations were well done. I've learned a lot, and they were quite simplified. Thank you very much.
Do you have any questions? Any aspect that it's not clear or you want to clarify more?
Not at present, but I think it would be helpful to post the presentations on the group again so we can go over them. But
yes.
I don't have any questions at present.
As I mentioned in the group, I mean, when you're going through the presentation, think about which areas you would change, or I mean, I mentioned about which slides you would elaborate more, which slides you would be aware of. I mean, this is like 10-minute presentations, and I've requested them to keep it to 8 minutes so that you don't overshoot 10 minutes. So it's challenging to keep a presentation on a topic. And the reason for choosing these topics, these are the 2 most important aspects of pulmonary mechanics in terms of practical application. So if you understand these concepts better, it would help you. Dr.
Yes.
Samarth, do you want to say anything?
Thank you, sir.
Thank you. Do you have any comments, Dr. Samarth?
Good evening, sir. No, sir. Both the presentations, I suppose, were excellent. I was a bit late in joining. I could not see Dr. Akansha's presentation, but I'll surely be reading it once I get the time and once it is shared in the group. But Dr. Avneet's presentation was really nice, and same feeling. This is the new thing that I've read and I've learned how FRC is affected and how extubation can help us improve FRC. This was very new to me. I haven't read about it before.
Very
But
important
really
concept, which you should teach all your nursing staff. The
Yes, sir.
concept
Yes,
of
sir.
FRC is very important. Not
Yes,
only extubation, she mentioned apnea of prematurity, and when you're any handling, for example, post suction, you lose your FRC.
Yes, sir.
High frequency as well, it's very important. So FRC is one of the most critical, and of course, complaints when you're dealing with acute RDS complaints becomes very important.
Right.
Again, I mean, try to keep your videos on. Don't be shy.
Sure, sir. Sure.
No, I mean, not for those who are keeping it on, but Dr. Kamaldeep, do you want to say anything?
Sir, both presentations are very good, but I am learning these things for first time only, and Dr. Razak's presentation was also very simplified, and these two presentations are also nice.
wanted to just ask, so I just wanted to ask, are there some ventilators which can sort of show you what the lung compliance is as a measure?
Yes, most of the modern ventilators are able to show you on the screen. I mean, the Drager, the Mackay, SLE, I mean, also shows the complaints, and the Drager and the more modern ventilators, they show all the calculations actually. The C20 IC that she mentioned is also shown on the ventilator.
And do you sometimes use it as, like, practically? Do you use
we come to pulmonary mechanics? I mean, there is a talk on pulmonary mechanics towards the end, and we will have that as part of the PCS session as well. What do you call the waveforms and loops? So when we are discussing that, we will discuss how we practically apply. Of course, we should train ourselves to look at all this, and that's the beauty of having all this ability. Okay, so Dr. Iftikhar, do you have any questions?
All right, thank you.
Thank you, Dr. Marcia. Safe driving.
Thank you.
Dr. Iftikhar, I think some of you are not fully familiar with Zoom. I mean, where to unmute and where to keep your video on. So,
Dr. Priyadarshini she raised her hand, sir.
I think she finished, right?
No, ma'am, it was for that last question.
Yeah.
I lowered my hand now.
No problem. So I think, Dr. Krishna, do you have any comments?
No, sir. Good evening, sir.
Yeah, we have discussed the OCS for the next, like the end of the month. I've requested one of the colleagues, but if he's not able to do it, he said he'll confirm in a couple of days. If he's not able to do it, are you able to do it on the 29th along with Dr. Priyadarshini?
Okay, sir.
Okay, so if he doesn't come back, if he comes back, because I'm only picking those who are not coming for the PCS, and we also need to choose the ones who will attend the PCS as well. So, Dr. Momita, was your doubt answered in the response by Dr. Razak? And I think Dr. Akansha also touched on that.
Yes, sir, I got the answer. My query was about the time constant in case of respiratory obstruction or in case of meconium aspiration syndrome. But, sir, my doubt has been cleared after the explanation.
The static and the dynamic compliance difference as well, isn't it? So one of the important differentiating features, Dr. Akansha's slides will be shared as well. And so in dynamic compliance, you will see the hysteresis, because the reason the hysteresis happens. Dr. Mala, do you want to talk about hysteresis? Do you understand what hysteresis is? Is that the right name on the screen, Dr. Mala? Okay, she's busy. Dr. Sai Priya, do you want to try? What do you mean by hysteresis?
No, sir, I'm not sure about that actually.
Okay, maybe Dr. Akansha can explain that. Jyoti, maybe you can project the slide towards the end of Dr. Akansha's presentation so she can talk a little bit on hysteresis. So the one on dynamic complaints towards the end of Dr. Akansha's presentation.
Okay.
Screen share.
You want me to share it now, sir? Or
Yeah, sure. I think it's the last but one slide. Come down.
This one, sir.
One above that. Yeah. No, above. Go back. Okay, this slide is okay as well.
This one, sir?
The one after this.
Before this or after this?
After this. Yeah. So, Dr. Akansha, do you want to explain?
Yes, sir. I will try. So, the space between the lower curve, that is the inspiratory curve, and the expiratory curve, the area between two curves, is basically hysteresis. It represents the
No, I mean,
amount of...
Just 1 second. I think you're not right.
Yes, sir.
So we have, anyone else wants to try with this slide? Dr. Momita, do you want to answer hysteresis? Dr. Nishant, do you want to try?
Not very clear, sir.
Okay, so hysteresis is basically, I mean, one of the key principles. I think Dr. Ajeshwar unmuted. Do you want to answer, Dr. Ajeshwar? So when we talk of lung recruitment in high frequency, you should be very clear about what hysteresis is. So, I mean, you can see, I don't know if you will see my arrow. I mean, if you see the pressure at which you are reaching a volume in inspiration. So for example, I mean, here we don't have the numbers here, but if you assume that one particular point, you can't see my, I mean, Jyoti, do you want to drag the pointer to where the beaking part is? No, on the curve, yeah, that's fine. So that point, if you assume the pressure at the bottom on the x-axis is 20, you can see that the volume, I mean, just see the comparing volume on the y-axis and see that the volume is maintained till you drop on the expiratory curve, till where it causes the upper inflection point. Can you move your pointer to the upper inflection point area on the left side? Yeah, on the, yeah. So you can see that the volume is the same from where the first arrow was to where this arrow is. So the drop in pressure happens without any drop in volume. And this is because of the dynamic compliance, which is including the resistive forces in the airway. So obviously that works as a measure to keep the lung volume despite the drop in pressure. You understand now what we mean by dynamic compliance? So the measurement of static compliance is a lung property alone, but when you're bringing in the airway property, like she showed in the picture with the hose and things like that, I mean, that's where the airway components come in. And in practice, that gives us hysteresis, which basically means you can drop the pressure till a certain level. So anyone used high frequency in your practice, do you want to comment on what will guide you when you're using the recruitment, derecruitment? It's FiO2 basically. So you're looking at the FiO2 as a surrogate marker for this. If the FiO2 stays the same, you keep dropping the pressure gradually. So go back and read about recruitment of the lung in high frequency. We will be discussing that in Dr. Vineet's module as well on high frequency ventilation. So, and this is part of the PCS as well. So you can stop sharing now. I hope this point is clear. Try to learn points like this. I mean, hysteresis was mentioned in Dr. Razak's talk, but I think it wasn't detailed much. That's why I asked that question. If no one has any other comments, I mean, we have potentially picked the presenters for the next OCS. We still need to finalize the presenters apart from Dr. Rakesh and Dr. Payal. We need 6 more presenters for the physical session. And obviously, we will exclude them from the further OCS presentation. So that's why we need to finalize those 6 and then we will go ahead. All of you can go back to watch the recording of this session as well if you joined late, and those who didn't join this session, obviously they have to go back and watch this, and I think Jyoti is keeping track of that. If any questions apart from what we have discussed, you can feel free to message in the group as well. Anyone wants to comment anything before we finish? Any feedback on how the system is working?
Sir,
yes, Dr. Ajeshwar. Yeah.
Sir, I think today's topic was the most important topic for this whole ventilation, because the concept of FRC and time constant, every time I start reading it, it added some confusion. Because I try to clear my concepts by more reading further.
Yes.
And will post my question in the group, because whenever we attend any workshop, any ventilation, these are the common terms that keep on coming in, because it is a common thing. But the crux is the managing the FRC and how we clinically manage the baby, and how do we interpret the ventilator as a machine.
Exactly.
And that part is very important, because there will be no machine that we can learn on single machine. Every unit will have different machine. We'll try to master our own machine, which we will have, and then slowly we can learn. I have some confusion regarding this time constant thing, and every time I learn about these graphs and graphics, because in every ventilation part, this is the topic which I find very difficult to understand, and I'll try to learn and unlearn or learn this week, and will post my question in the group. And
No worries.
very nice presentations by both the Dr. Abneek and Dr. And they've done a very great work.
And is this system okay? The way the OCS is running, is that okay if anyone follows the same template? I mean, I think Dr. Karthik will be running the next one. But this format, is it okay for you? The presentation and MCQ and then some discussion?
Yes, it is absolutely okay.
Okay. So if you want, I mean, one of the topics for next presentation can be time constant as well. Dr. Priyadarshini, do you want to do that topic?
Yes, sir. I'll do it, sir.
So the other one will be a clinical case presentation, possibly on respiratory failure, because the next module will start, which will be respiratory failure. So we can have a practical topic and this time constant continuing with this module and go through Dr. Razak's comments and discussion as well. And if anyone has questions for Dr. Razak, post it in the group. I'll share his response. Okay. So thank you everyone for joining.